right. Good afternoon, folks. I see folks are coming in by the wave. So happy to have everyone. Thank you all so much for spending part of your afternoon with us today. As we get ready to begin, please feel free to the emoji poll that we have listed here on the screen. Um, excuse me. Yes. So good afternoon, everyone. We will start in about 1 minute, so feel free to get yourself comfortable, whether it's at your desk or couch. Um, get ready for some really good learning. And again, as you all are joining, feel free to drop an emoji in the chat. Let us know how you're feeling. All right. Oh, and Erica Warren, yes. Sometimes I feel that way too. Just hands up, like what's going on here? Well, let me help clear some air and make way for some clarity. My name is Bianca Reed, and I am so happy to have you all here for our virtual institute. Again, as folks are entering the room, feel free to drop an emoji in the chat and let us know how you're feeling. And as we move forward within this presentation, if we could just go to the next slide, please.
Sorry, my computer is doing something super. Oh, there we go. Sorry about that.
No worries.
There
no
we go. All right. Usually
worries.
that is not the technical part I have trouble with. Click to the next slide. Go ahead,
No
Bianca.
worries. All right. So again, as I mentioned, my name is Bianca Reed, and I am here as a training and technical assistant associate here to support the amazing work that we are doing here within OST. And again, thank you for joining us for our virtual institute on advancing health equity within OST, focusing on our assessment to action. Some housekeeping, as I'm sure you all are quite familiar with, are listed here on the screen. And again, just as a reminder, everyone will receive a copy of the presentation and a recording of this session as well. All right, so again, as a friendly reminder, this is session 2 of our Assessment to Action Virtual Institute, where we are happy to talk a lot about how are we assessing our work and how are we making sure that we are advancing equity and health and healthy eating and physical activity in our institute. So in the chat, what I would like folks to do, if you feel comfortable, please feel free to share your name. But also, if possible, we would like for folks to rename themselves on the Zoom by putting the abbreviation of your state. So that gives us a really good opportunity to know where folks are chiming in from all over the nation. So as we see here, the example that I have, Illinois, Bianca Reed, that is my name. That is where I'm from. And so, again, please feel free to introduce yourself in the chat or by updating your name so that we can see the state you're from. Right, and we have Minnesota. So far, I see Minnesota. That is awesome to see. In Illinois myself. All right. So we are the Collaborative for Advancing Health Equity in Out of School Time, and we work to improve the health and wellness and well-being of youth and staff in OST programs, with a particular focus on groups that have been marginalized and are the most impacted by health disparities. So our work is done in collaboration with the National After School Association, and all of this work could not be possible without the funding and support from the Centers for Disease Control and Prevention, also known as the CDC, and we welcome some CDC folks here today. So again, thank you all for joining us today. All right. So, as previously mentioned, this is session 2 of 2. Our previous session focused on the first 3 learning objectives for our entire virtual institute. Now, those learning objectives were involved building equity considerations into planning and the implementation of HEPA standards, creating a team that needed capacity, and identifying standards to focus on. But now we're going to be focusing on the big 2. Now, our big 2 are, again, anticipating implementation barriers and proposing changes to test and address these concerns, and also creating that action plan that centers the HEPA standards. And so those are what we're going to be focusing in on today. So today's agenda is actually pretty brief. We're going to have a very small recap of our previous session, and we're going to take some time to collaborate as a large group to brainstorm on challenges, solutions. Then we'll take some time to discuss creating an action plan. What does that look like? What is important in it? What are the things that we want to be mindful of? And then we're going to hear from some amazing partners we have with OSNAP, who is going to review some overview and some tools that really help strengthen the work that they do and the work that we do as well as team. And then we will move forward and talking about some amazing opportunities for folks to engage in, and we'll do a closing and feedback as well. So we are really excited for all of the great things that we have in store here today. And so I'm going to move forward and introduce Kate Goddard, who will talk a little bit about the assessment to action and our recap from our previous session. Kate?
Great. Thanks, Bianca. So great to see you all here with us today. Welcome. And just a few reminders that Anna has been sharing the links to the assessment to action guide, which is here on the slide. And for those of you who are unable to join the first virtual institute, no worries. We're going to do a quick recap and we have it recorded. So everyone will receive all the, as Bianca mentioned, everyone's going to receive the materials and the recordings from all the sessions. So again, I'm Kate Goddard. I'm the project director for the Collaborative for Advancing Health Equity in Out of School Time. And we are thrilled to share with you all our newly published assessment to action guide. So as you can see on the slide, the guide outlines 6 process steps to support your efforts with implementing the National After School Association's healthy eating and physical activity standards for out of school time with an equity lens. So during our first session, as Bianca already kind of covered, during our first session of the Institute, we walked through those first 4 process steps. And today we're going to spend time with steps 5 and 6. And again, the link to the guide is in the chat. Claire Grace, can we go to the next slide, please? Thank you. So to recap very briefly, step 1 is all about getting familiar with the tools, such as the National After School Association's healthy eating and physical activity standards for out of school time. These standards support evidence-based strategies that translate nutrition and physical activity science into actions you can take to offer healthy foods, beverages, and physical activity in your programs. The standards also address staff training, program culture, policies, program management, and the environment. So note that these standards are very aspirational in nature and that you should really think about how to tailor them to your specific context. And of course, that's what we're doing in this institute, having you think through how to strategize and how to prioritize the standards you want to implement. Next slide, please. So then in addition to the HEPA standards, as part of step 1 of getting familiar with the tools, there are also 2 assessment tools that we recommend utilizing. And that is the Healthy Eating and Physical Activity Standards Self-Assessment Tool, as well as the National Center on After School and Summer Enrichment's Out of School Time Equity Planning Checklist. We think that these 2 tools used together can really help you strategize and prioritize the standards you want to implement, again, with that equity lens. Next slide, please. Great. And then step 2 of our process steps outlines strategies and considerations for gathering a team to support these efforts. So as outlined on the slide, this helps to ensure broad and diverse representation and builds buy-in early on in the planning process which will help with sustaining your efforts. So during our last session, we spent a time as a group brainstorming partners, resources, skills, and data that can be leveraged to inform the planning and implementation of the HEPA standards. And again, those archives are available as well as the brainstorm. So we'll make sure everyone has access to that. Next slide, please. Great. And then finally, we covered steps 3 and 4, with 3 really focusing on the step in which you complete the assessment tools. And 4 is about prioritizing what you want to focus on. I really encourage you to check out the guide, as there's some key questions outlined in step 4 that are really helpful for thinking about how best to prioritize the standards and your goals for your program. And again, just remember, this work is aspirational. It's about starting where you are, making steady progress towards your outcomes, and celebrating your successes. And that's what we're here to do, to support you all, and what that guide is intended to do as well. So with that, I'm going to turn it over to Claire Grace to get us, diving into step 5.
Thanks, Kate. I'm Claire Grace, and I am a Training and Technical Assistance Associate here for the Collaborative at EDC. And I get really excited about, thinking about how to help take this work and really move it into action. And so that's what we wanted this guide to help do. Thinking about equity and thinking about the HEPA standards, and Kate talked about how they're really aspirational. There's a lot of them, but they are within reach. They're absolutely doable, but having a plan to think about, how can we pull a group together to really think about what this looks like in our community, in our context, and how can we take this from a vision and something we want to do to actually putting it into action and implementing it. And so today we're going to focus on the next step, which is to brainstorm challenges that you may potentially face when you get ready to implement, and to think about solutions so that you're ready to really take this work and move it into practice. And so before you create this plan and put it into action, it's helpful to anticipate these challenges, brainstorm solutions, and think about changes that you want to test. And then, as you think of these changes, you can think about maybe testing them on a small scale, and how you're going to kind of roll things out to get to full implementation. So one tool that we really like to use, that we feature in the guide, is called a key driver diagram. This is a tool that's used often in quality improvement. I just want to take a minute to kind of break down this example, and then we're going to have an opportunity to do one together. And so the aim is really what it says. What is our aim? What is our goal? What is it we want to do? What's the standard that we want to implement? Or, what is our activity or goal that we want to see happen? And so in this case, I chose offer daily outdoor activity. And then the drivers are, what are those things sort of like behind the scenes happening in your context that might be able to prevent you from really having equitable implementation and being able to achieve your aim of offering daily, daily outdoor activity? And so 2 examples that I thought of might be, one might be that youth might not have weather appropriate clothes. Another might be that if students that have recently immigrated might feel left out or don't understand the rules of games that we play all the time. And so you then take those drivers, which, as we kind of talked about in the first session, you're really coming up with a diverse group of minds at your table to be able to anticipate what some of these might be. And so you've got staff, and you've got youth, and you've got members of populations of your community that you really want to make sure that you are working with and addressing health outcomes, for all of these folks. And so together you're coming up with these drivers, and then also using that group to help you come up with some potential change ideas. And so if one of your drivers is that you think that youth might not have weather appropriate clothes, and that makes it really difficult to get outside every day for physical activity, one idea might be that you could partner with local secondhand clothes charities to donate items to you, to create a clothing closet so that you can, grab out winter jackets, or that you'll have boots on hand for kids that might forget theirs. Or maybe, maybe you think that your students often do have the items that they need, but they often just forget. They don't really, they're not sort of thinking ahead of like, oh, tomorrow it's going to be rainy. And so they should make sure that they've got something appropriate that they can still, get outside, or it's going to be a little colder tomorrow. And so another change idea that you might try is to set up text reminders for parents in their preferred language. And maybe you do that at the beginning of the week. Hey, we're so excited for our upcoming week. Here's some suggestions for, what might be helpful to have, because as a reminder, we play outside every day. So, Monday, extra pair of socks, Tuesday, warm jacket, whatever it might be. And then for, thinking about how to really bring in some everyone to be able to participate, maybe thinking about having some student-led activities where students can share some different games from their background or things that they're familiar with. And then we call these change ideas because the idea really is to test these, to try one out, to try a couple of them out, and to see, is this making a difference? Maybe it turns out we tried sending a text reminder at one of our schools, every week on Monday, and it just didn't really seem to make a difference. So maybe we're going to try instead sending it on Sunday so people can get ahead of the week ahead. Or maybe we're going to try sending a quick one out, every night the night before, or just when we know the weather's, changing and maybe people aren't looking ahead to know like, oh, it was so nice at the beginning of the week, and now on Thursday and Friday it's going to be a little cooler, and we want everyone to be prepared for that. And so this really helps you work in that continuous quality improvement to get towards your aims by breaking these into small things to try out and test. And so we're going to try and do one of these together. And we thought it might be fun to start out by having you come up with some of the drivers. And so we're going to do this example together, focused on the aim that we want all staff members to participate in training or professional development on healthy eating, nutrition, and physical activity at least once per year. This comes right out of the HEPA standards. And so just a couple of notes, there's a link, and I'm going to activate the poll in just a second if it's not already, but you can use the link that's in the chat to enter your response. Just to note that if you use the underscore in your response, like in this example, it'll keep your words together. We're going to make like a big word cloud, and then we're going to pull a couple of items from the word cloud and use that to fill in our example. So I'm going to stop the share. And Kate is going to bring up our word cloud, and I'm going to, oh, good. It looks like it's activated. So folks can go ahead and start entering some responses in. What do you think are the drivers, the things that might present a challenge to being able to offer staff training every year on physical activity and healthy eating? Oh, great. All right, so I can see some coming in. Awesome. So schedules, I see not enough time, scheduling conflicts, having food, talking about the benefits, availability. Great. And just a reminder, if you have multiple words in your answer and you want them to show up all as one answer, if you use that underscore between your words, it'll come up as like a whole phrase instead of breaking your words up. All right, childcare. Yeah, great. Knowing what the resources are. All right, we'll keep these coming. I'm going to give just one more minute. It looks like we've kind of slowed down here. I'm going to bring the slides back up. Whoops. Thanks, Kate. I'm going to bring the slides back up, and we are going to pop a couple of these into our diagram. So, Kate, can you give me
so the resounding one is scheduling and time. So I think let's start with that one, knowing that that is one of our key drivers to address. And
Awesome.
then let me look at the others. Well, why don't we do scheduling, and then why don't we do buy-in? There's a couple comment,
Ooh,
that's
great.
kind of showing up large as well. Getting staff buy-in, and yeah, let's do those two. Let's
Okay.
at the top.
Awesome. Great. Actually, let's do, yeah. Okay. Awesome. So let's start with scheduling. So now what we'd love for everyone to do is to share your ideas in the chat. And so if scheduling is a challenge, what are some of the things that you have tried or could try to get around that barrier? What are some ideas that you could try if scheduling is one of the drivers that's a barrier to doing this? So you can share your idea in the chat, and Kate is gonna monitor the chat and feed me some ideas to pop into our diagram here.
All right. So thanks, Kate. So one idea here is offering multiple days or times. I'm assuming for the training. And then another option, another idea is to also have virtual and recorded trainings.
Awesome. And usually when you fill out this diagram, you would come up with just, a little, like a single box for each of these so that you could then kind of think about them. But if we've got a bunch, we can add a couple more in just so we can see some of the change ideas. If you want to add a couple more, we'll just pop them in here.
Yeah, just to see them. I think that's great,
Yeah.
Claire Grace. Another really, I think important one to also think about testing is having administrative time set aside for training and PD. And then here we got two more coming in. One is around
Great.
having, I'll hold for you. Yeah.
Yep. No, go ahead.
One is around having substitute teachers on
Oh,
hand
yeah.
and available.
Okay.
And then designate all staff meetings of the year that already exist and use that for training. So using existing previously scheduled meetings for training. I don't know how you can.
Is this, I'm going to say capture existing time. Is that
that looks good.
Okay, great. Awesome. All right. And whoops, my little Zoom bar is in the way from dropping that one. Let's see. Okay. And then how about getting staff buy-in? What are some of the things that get in the way of staff having buy-in, or that you think you could build staff buy-in for having a commitment to doing training around physical activity and healthy eating?
Oh, Denise, great one. So Denise mentioned having one or more staff members be a leader in sharing the information with staff who missed. But yeah, I think just having other staff kind of take leadership and be communicators is really great. Jimmy, great one. We know this is a good one. Compensate for time that is for being in the PD.
Yep. I think we have room to fit a couple more.
And then this is great. Thanks, Kristen. Role modeling from leadership. Wonderful. And then maybe we can get one more idea in there.
Yep.
These are great. This might be one that's a little harder. I think we've captured all the good ideas there.
That's
I don't see
okay.
anything else.
Well, or if anybody wants to unmute, or anybody from our team wants to unmute and throw in one more.
Here we got people got a couple more. So thanks, Denise and Sarah and folks. One is giving everyone a role in the implementation of the PD. Having staff have some choice in picking the trainings. These are great. Thanks all for these ideas.
That's what I was just thinking too. I think like okay, I can't type and talk. Staff role in trainings. Yeah, I mean, I often think too, the more you can involve, the anything we're doing, we want to be involving the population we're reaching, right? And so for us, we're often, if I think in out of school time, we're often thinking about, how we do that with youth. But I think also, I'm sure many of you do this, thinking about how to do that for staff as well. So how do you involve them in the decision making? How do you, really get them involved in understanding the importance of why we're even doing this, all of those pieces. So these are great. Thank you so much. I'm going to go ahead and clear, I'm going to go ahead and clear these drawings. Clear all the drawings and
Just to connect with that, Claire, Grace,
yeah, please.
staff being able to have prep meetings with the presenters, right? So I
Mhm.
think, staff are the frontline workers. And so the more they can actually share about, challenges, successes, real cases, the better, right? That the speaker can be. And also to think about, who are subject matter experts. We want to think about folks who have letters next to their name, and members of the community can be that too. So I think it'd be great for staff members to think
Mhm.
about that.
Yeah, absolutely. While we're here for a minute, does anyone else have any, I'm going to stop the share for just a second. Anyone else have any ideas? I know that this is one that comes up often. And so are there other thoughts about some ideas that you've tried or could try to implement this standard around being able to provide consistent, professional development for your staff? Anybody else feeling brave and want to unmute or share in the chat?
One of the things I've done is because I have after school programs and I have a plethora of certified staff that work all day long. I have college students that go to school during the day. And then I have support staff that also work all day long. So what I try to do is that we have about a 2-month shutdown, and I try to make sure all of the professional development that I need to implement for the school year is offered then. And I not only offer it during that shutdown time, but when I do, I'm very intentional in that I choose a weekday and then I choose a Saturday, because some people then have part-time jobs during the summer or what have you. And we're usually shut down July and August, technically. So we start up towards the end of August. So I only have about a 1.5-month gap there to get it done. But that's what I do. And then I let them know they need to choose one of those 2 dates to be able to get that training, because requirements from our State Department is that we have extended learning program specific professional development. And so I have to plan those accordingly. So that's what I try to do. I have to be of course, this is 10 years of doing this now. So I've learned a lot of mistakes in the past, what works better and what have you. So I don't know if that helps anyone.
That's super helpful, Brenda. And I think what a great example, right? Saying like 10 years, that's 10 years of trying all these different change ideas and seeing which one seems to be the most effective. Absolutely. All right. Does anybody else want to share something they've done that's been successful, or an idea they might be thinking about trying? While I pull my screen back up here. All right. So kind of moving our way through the guide, taking all of these pieces. So you've brought these voices to the table to help you think all these things through, and you've done your assessments and you've thought about what you want to focus on. And then you've brainstormed what might get in the way of that. What are some of the smaller things that we want to try to be able to really have successful implementation? And we now are going to take all of that and pull it together by creating an action plan. And an action plan really just takes, I kind of see it as a visual roadmap. It takes all the things that you would like to achieve or accomplish, and it breaks them into smaller steps. And then it kind of builds in these like sort of benchmarks or these pieces along the way that help keep you on track. And so in the guide, we have templates for all of these in the assessment to action guide. And so this is the template that we have pulled together for doing your action planning. I often find this piece about what is your goal at the top, again, when you think about engagement and buy-in, I think it's really helpful to always be bringing everybody back to what is your big goal. In the end, what our ultimate goal is we want the healthy choice to be the easy choice, or our goal is healthy students and staff, or whatever your big goal might be. And then what is the standard or priority that you're focusing on for this plan? And so, maybe it's the one that we looked at for this particular plan is going to be around having daily outdoor physical activity. And it's going to include all the things about making sure that staff get trained around it, that our youth are able to have weather appropriate clothes, that we've secured space to do that in, that we have the materials and resources to engage in this. And so it then breaks it. So you're going to think, so you can list some of those at the top. Let's keep these top of mind. What are these drivers that we're going to want to make sure we're addressing in our plan? And then you take each of those and break it into these pieces. So what are the actual steps? What are the steps that are needed? What are the things that we need to try to get to successful implementation of those? And then what resources will we need for each of those things? And so, again, if it's, we want to partner with a local clothing closet to provide us with weather appropriate clothing. So what are we going to need to be able to do that? Who we need someone to be able to coordinate that. We're going to need a space to keep it. Are we going to need to get a grant or to offer some fiscal resources? Maybe even if the clothing is free, how are we going to get it to our site? What are the resources that we might need to make that happen? And then what's the timeline? Do we expect that we'll be able to work on this partnership and get all of the logistics planned, and in 3 months, we'll be able to start utilizing it? And then who's going to be responsible? And this work, we all know, in all of these things, that many hands makes light work. And so choosing the person whose name goes in this column isn't that one person. Often I find coordinators and program directors tend to put their names in here a lot. And that it doesn't mean that one person is doing the work. It means who's the person that's just going to kind of oversee and coordinate and make sure all the work is happening. And often it's really helpful to choose someone that is not the program coordinator, to be someone, maybe a staff member that's really interested in seeing this happen. Could be the person responsible and with the support of their director or their supervisor to be helping kind of check in along the way. And then what is the measure? How are you going to know this was completed? And so what are your benchmarks for, great, we're going to have a memorandum of understanding or some kind of like written agreement, or we're going to agree by, have an email that shows that that we've agreed, and here's how this is going to work. What's the measure going to be? And then a place just for you to put some notes. If you've run into a roadblock and you're going to try something else, if you need some additional resources, it gives you some room to do that. And I'm a huge fan, whenever possible, of sharing things like this and sharing, grant documents and all of these pieces with my staff when I'm doing, the one who's kind of doing programming or implementing grants or things like that, because I think it's a nice way to build engagement and buy-in, that they can see through this whole process. Why are we doing this? Why have we decided to do it the way that we're going to do it? And how are we expecting to do it? And that being able to have this all written in one place can be a really nice way to share this information and to build additional buy-in for moving forward with these efforts. And then I just wanted to take a few minutes to share. This is an example that's shared in the assessment to action guide of one that is already filled out. This is just kind of a snippet of it. And so our overall goal is that we want to create accessible, safe spaces for daily physical activity. And as we said, we were kind of building this example around offering daily outdoor physical activity. Some of the drivers that we've considered are needing weather appropriate clothing, culturally responsive activities, options for competitive and non-competitive activities. And so again, the first, we kind of talked through this first action step that you can see across the top there. A second action step might be if we really want to make sure we're providing culturally appropriate activities, that we want to try doing that by sourcing ideas from staff, youth, and families. We're going to do that by holding an outdoor family event that provides an opportunity for families to lead some of the activities. And that we want to create a system for choosing a student each day to lead an activity. And what we're going to need from that is a way to get ideas from youth, staff, and families. This is going to be something that we don't have a specific timeline for, because we really want this to be an ongoing activity that happens. We've decided that Kate will be the lead organizer for our family night that we're going to plan for in October, and lead staff each day will support the students, a student in leading an activity. Our measures will be the number of families who attend our family night and the number of new games and activities and ideas that are generated. Oops, sorry. So before we move on to the next section, does anybody have any any thoughts that they want to add to this, or any additional ideas? Any questions about that whole section? Everybody's taking it in. Yes, Jimmy, this one we kind of, so Jimmy shared in the chat that for their action plan, they had to develop SMART goals. Absolutely. I think even taking that a step further and developing SMARTY goals that are specific and measurable and achievable, that are realistic. I'm trying to remember the acronym. You want your goals to be specific, measurable, achievable, realistic, time-bound. So we covered a lot of those things also in our action planning. And you want to think about how they can be inclusive and equitable. And so I fudged it a little bit and wrote some sort of just general goals that I think people might be interested in working on. But in the assessment to action guide, we do have some guidance and some resources for being much more specific. So, what does it mean? We want all the students in our program to be healthy. Well, what does that mean? What is it going to look like? And so what's your measure going to be for that? How are you going to know that you've achieved it? Is it that you're going to increase something? Is it that you're going to see something specific? How are you going to make sure that in doing that you are being equitable and inclusive? And so is it that you're going to write your goal around a specific population of students in your program that haven't been as engaged, or that you'd like to reach from your community to have join, whatever it might be. And so thank you so much for raising that point. And I think it's actually really important. Denise shared that another idea might be actually having current families donating items, and that could help create some buy-in. Absolutely. Other thoughts or questions about any of these couple of pieces? I'll give it just a minute. I have a tendency to jump right in. So I'm going to give a minute of space here for anything else. All right. Well, and we're going to have some more time for questions at the end, but right now we are going to transition into our invited presenter. We spent a lot of time kind of going through our guide and how to go through all these steps. And so we are really excited to have invited Becca Lee, who is from OSNAP, and she's going to tell you more about them and all the things that they have to offer. But I just wanted to share that the reason that we kind of timed it and invited them to come to this specific virtual institute is because their resources are amazing. And I think if you haven't utilized them before, it's a really nice way to get more of these ideas and plans and ideas for different like policies and things that you could pull into your planning as you're going through the assessment to action guide and getting to implementation. And so I'm so excited to have Becca Lee with us. She's a lecturer at the Harvard T.H. Chan School of Public Health at the Prevention Resource Center on Nutrition and Physical Activity. She uses mixed methods to conduct research and evaluations with partners including the YMCA, Boston Public Health Commission, Massachusetts Department of Public Health. Her research focuses on designing and evaluating community-based interventions that translate into real-world policy and environmental change, focusing on investigating the contextual factors that impact effective implementation and promote health equity. She was part of the team that designed the out-of-school time nutrition and physical activity, that's OSNAP acronym, intervention, and led efforts to establish its effectiveness on children's dietary intake. She also led a study that demonstrated how to successfully scale up OSNAP for broad impact and population reach, yielding improvements in nutrition and physical activity practices. Becca serves as the director for the Community Engagement Program at Harvard Catalyst, and she's the co-director of Leaders in Health Community Training Program. And Becca also has invited a couple of her colleagues to join her today, and I'm going to hand it to her and let her introduce them.
Thank you so much, Claire Grace. Yes, I'm also joined by Jenny Reiner and Molly Garone. They'll be popping some links into the chat for me, and they've helped me put together this presentation for today. So I'm really excited to be here. I haven't talked about OSNAP in a little bit, and it's been exciting to pull this presentation together and think about how to reinvigorate using these resources with a new group of folks that are here today. So thanks for having me. Next slide. So I just wanted to give you a little bit of an overview of OSNAP. The aims of OSNAP are to identify and support lasting and cost-effective policy and practice strategies that promote healthy foods and beverages, physical activity, and screen time in out-of-school time settings. So you'll see already that there's a lot of synergy and overlap and alignment between what you're doing here and what OSNAP is all about. In OSNAP, we bring together out-of-school time providers to learn from one another and set goals to meet the OSNAP standards or goals. So when we're thinking about making changes in out-of-school time programs, we think about it at multiple levels. So a lot of what folks will be doing is kind of in this program practice space, the second bullet there, where we're changing the day-to-day operations in our programs, like serving water at snack time or offering more options for physical activity. I think that's where we usually start, but it's important to kind of think more at the individual level and kind of broader to think about all the potential ways that we can create change in our program. So when I'm thinking more individual, you might change the program practices, but you might also, in addition, need to be encouraging individual children to eat more fruits and vegetables or participate in physical activity. And then when I'm thinking above the program practices, the types of things I'm thinking about are informal policies. So changing maybe the program schedule or menu. Those are written records of what you do, but they're not quite so formal. Or more formal policies, like this could be at the state level, like state laws, or it could be at your program level, like a parent handbook or a staff manual. And I'll be talking a little bit more today about how we think about policy and the resources we have for policy change. Finally, we think about health communication. So it's important not just to keep all the changes that you're making within the out-of-school time day, but think about how you can share information about the changing practices and policies with families, partners that you work with, maybe outside partners that come in and help provide different services to the kids in your program and the kids themselves. So the OSNAP model, we use this kind of circle of change, thinking that there's as similar to what Claire Grace was saying, continuous quality improvement. So there's always more room for change and improvement, and that's why this is a circle. We always think about starting with assessment, similar to you all, and then move on to learning and identifying. In learning and identify are most of the things that we're talking about today. So brainstorming challenges, setting an action plan, all those types of things happen within OSNAP. And then you go and try to implement those things, communicate out what works, track your progress, reevaluate at the end of the year to see what might have changed, and start up the next year to see what additional changes and improvements you can make. Next slide. Great. So why would you implement the OSNAP model? It is evidence-based. We have conducted research showing that the water served in the program increased. There were increased policy changes. There were healthier foods consumed by the kids in the program, and we increased vigorous activity. So that was in the original study that we worked on. People also liked doing it quite a bit. And so there's favorable outcomes in terms of participants really liking those learning sessions. It also helps meet federal, state, and local policies. Next slide. So these are our OSNAP goals. We're not going to spend too much time on them today because the OSNAP goals are so aligned with the HEPA standards, but just to share that these goals were really created hand in hand with after school providers. We tried to make sure they were realistic, going back to SMART goals, and achievable, and they were really practical goals that align with, what types of changes really can drive the health behaviors and improve the lives of kids. Next slide. So in terms of our OSNAP materials, I'm going to walk through, and there's some QR codes that are in here if you want to access the materials, but Molly's going to also be popping some of those links into the chat as well. So we have a variety of different materials on our website. Our website was recently revamped this summer, so if you maybe have seen it once before, it's a little bit different now, so please go back and check it out, or check it out for the first time. We have things ranging from implementation guides and learning community guides for you to actually run this whole intervention yourselves. But we also have other materials that I'll be digging into a little bit more. Next slide. So the OSNAP implementation guide is a step-by-step guide for running an OSNAP learning community. An OSNAP learning community would happen over 3 sessions over the course of a school year. And it's designed for both the after-school program site director in mind, as well as the coordinator who might be bringing together multiple sites. It provides materials for programs to use directly with children and families. And it also directs users to different training templates and action planning guides, many different resources that we have, kind of a nice toolkit of how to run OSNAP. Next slide. And then our learning community facilitator handbook is for folks that are running those learning sessions themselves. And so it gives you all the talking points, it has slide decks, things like that, to really learn how to do a learning community locally. Next slide. So I'm going to spend a little bit more time on digging into each of these resources. So in addition to running a learning community, as I've mentioned before, some of these resources can be used as standalone resources or could be integrated in the work that you're doing here in this collaborative. So our tip sheets are what I think of as a really nice start for brainstorming those challenges. You can see real life challenges are right on the front. And we pulled those real life challenges from folks that were part of our OSNAP study originally and actually iterated over time. What were the most common challenges we were hearing when it came to trying to change physical activity or improve water access? And so we pulled those common challenges right to the front here to help people get brainstorming for what they might be able to do in their program. And then on the back side of our tip sheet, are more educational pieces, and those educational pieces can be really helpful for creating staff buy-in, teaching kids kind of why you're focused on physical activity or water or any of our other standards, as well as thinking about messages to send home to families. Next slide. And then our FAFSA maps, they're little thumbnails here, but I love our FAFSA maps. I think of them as kind of a choose your own adventure. And so there's all these open-ended questions that we have along the left-hand side, getting you to think about, is this a challenge? Is that a challenge? And then depending on how you answer that question, yes, no, I'm not sure, or maybe, that will direct you to an idea for an action step. And so it really is kind of this list of different potential action steps organized into the types of barriers you might be facing. So there's many more ideas on the FAFSA maps than there are on the tip sheets. Sometimes I like to have people start with the tip sheets if you're really new to doing this type of work. And then when you're kind of pushing forward, trying to dig deeper, the FAFSA maps are a good next step. Next slide. And then I wanted to talk a little bit about our policy writing resources. And so this is our policy writing guide. The thing that's so great about this is it's organized by goal. And those goals are going to be very similar, again, to the HEPA standards. There's not as many of them as the HEPA standards, but all the ones that are here overlap really nicely. And what we have here is actual sample language that you could pop into a parent handbook, a staff handbook, sample letters that you could use to communicate a policy home to parents or families. So in this example here, there can be different ways that you want to frame a similar policy. So in the first example, it's sugar sweetened beverages, including soda, fruit drinks, lemonade, sweet teas, energy drinks, are not allowed to be served during the program hours. We only serve unsweetened, unflavored water and milk. That is a very formal sounding policy. And that might be the vibe you want to be giving in your handbook. That might be what your other policies seem like. Or you could be much more simple. I mean, you could say something like only water, milk, and 100% juice are allowed at the program. They're kind of getting at the same thing, but they're taking different language to get there. And we actually have practice implications that go hand in hand with each example. So it can help you figure out, if I do want to set a policy around this, what are the trade-offs? Next slide. So why are we focused on policy? We really think it's important because it lays the groundwork for practices and programs. And it also helps with sustainability over time. And so sometimes programs spend a lot of energy, trying out different things at their program, trying to figure out what works best. Then there might be some turnover or just some memory loss over the summer of what did we do last year? And writing it down is a really good step for kind of solidifying those healthy practices in your program. It also ensures that everyone is aware of what is expected of them and what they can expect from the program. So it can be an accountability mechanism. It holds staff, caregivers, children accountable for following the program's rules. And so, I remember back when we were delivering OSNAP a lot, one of the most common reasons people ended up liking making policy change is they didn't have to be like, I had to tell the parent they're not allowed to do this. They could point to it in the handbook and say, the handbook says this isn't allowed. And it takes a little bit of that stressful experience off of that staff member, especially if it's a staff member who's trying to communicate rules at pickup or drop off. It's like, no, this is just the way it is at our program. And that kind of, this is the way it is approach can be really helpful. And it can be helpful with those informal policies too, like changing your schedule and saying, no, we do have a physical activity break that happens from this time to this time. I know homework's really important for your kid, but they are going to be participating in this 15 minutes before they go into homework time. And that's just what everybody does at this program. And it's part of our practice and policy. And the other reason we're focused on policy is there's evidence that suggests policies in school settings as well as after school settings can change food service, increase access to physical education, improve kids' dietary intake. And we have our own OSNAP policy evidence of this as well. Next slide. So in the guide, I mentioned already, it provides suggested language to support healthy changes. Going back to those letters to families, one thing that's great is we've slightly tweaked, but really kept the essence of these letters that after school staff sent home during the OSNAP research study. So we really modeled the type of language that you might use to actually communicate home to families. This wasn't written by researchers. It was really written by after school staff who are, sending flyers home to parents, and I think that's the added bonus. And like I mentioned, it includes an explanation of how practices would have to be changed to implement the policy. So thinking of those things hand in hand. Next slide. And then I wanted to shift gears next to talk about the communication piece. And so this is an example of one of our flyers that we send home to families. It's a way to communicate about what's going on during OSNAP. One thing I wanted to mention is these communication materials, they include things like sample newsletter articles and things like that, as well as educational flyers that are part of our food and fun curriculum that I think would be very helpful to folks to meet some of your equity goals. They're available in Spanish and Chinese as well as English. So thinking about how you can address language access with your program is something some of our materials might be able to help with as well. Next slide. So where can you find all this stuff? You can find it on our website. It houses all the tools I've been talking about, plus many, many more. I've only picked the ones that I thought might be, and we all thought might be the most useful to you today. There's many, many more there. And there's also the My OSNAP portal that I'll share a little bit more about in a second. It includes interactive assessments, reports, an action plan builder, and it allows programs to store information in return to make changes. So you have your own little My OSNAP place on our website that you can build over time. Next slide. So here's a screenshot of what that new website looks like. On the left-hand side, that's what you'll see when you come to our homepage. And the two things I wanted to emphasize the most are My OSNAP. So you can see there that there's this dashboard where you can see all of your program materials once you log in. And we suggest that if you do My OSNAP, to do this at the program level, not at the person level. So there was a lot of talk earlier about working as a team on making change at your program. We totally agree with that approach and think that if you are going to be working to create change around nutrition and physical activity and out of school time, you really need a bunch of folks from your program on board, and really doing My OSNAP as a whole program site works best. And then our resource library is really user-friendly and searchable, and you can find all the resources that we talked about today in our resource library. Next slide. So here's a little bit more about that My OSNAP portal. You can see a little bit of a screenshot here about how you can take our assessment electronically. One of the things that's really great about this new use of the website, or new iteration of the website, is it takes you right from doing an assessment, seeing where you're meeting the OSNAP goals, where you're not, and then bringing you right into almost an automated version of those fast maps that asks you a bunch of yes or no questions to give you ideas for your action plan. So it could be a mechanism that you could use side by side in alignment with the work you're doing here. Next slide. And then moving forward, the last thing I wanted to talk about is I always love to emphasize the importance of sustainability for doing this work. I mentioned it before. Next slide. We think always about this 5-step approach of identifying successes, not letting that kind of fade into the background, but really after you're working on OSNAP or any kind of a change initiative like you are here implementing HEPA standards, at the end of the year, what did you succeed in doing? What are those things that you want to lift up and share with other folks? It's really important also to track your progress. So not just identify successes, but identify areas where you're on the right track, but you might need to work on it a little bit more next year, or places that were more of a struggle. So looking across all your goals and where did you have that most success, but what did progress look like across all the different domains? We also think about staff development, and I'll talk about that more in a little bit, but how do we make sure that staff have all that they need to, continue to be able to foster a healthy environment? Policy change is part of that sustainability piece. And I think it's so important to think about in all of this, gaining the support of leaders. How do you take those successes that you identified and amplify them? So your boss, people, organization-wide, know what's going on at your program and how you've really improved the health of kids there. Next slide. So two fun resources that we have. We took some time to partner with folks that are human resources professionals to get ideas of interview questions and job descriptions that could be helpful in hiring folks that would be supportive of the OSNAP initiative. This was something that we thought of when we were experiencing super, super high turnover in our OSNAP sites. And so we said, as we go from, the spring of one year to the fall of the next year, what are some resources that we can provide for folks as they're trying to bring staff on board? And so these materials are available in that resource library as well. Next slide. So I just want to end with thinking about ways you can bring OSNAP to your programs. Please explore our resource library for practice and policy strategies, those things that you can find on the tip sheets and the fast maps, the policy writing guide. They are all free of charge to you. They are all easy to find. And that resource library, you don't even have to create an account. Anybody can go on there and find the resources I was talking about today. So I hope you'll use those in your brainstorming challenges and as you're thinking about creating action plans for your programs. You may want to consider creating an OSNAP account to track your progress and develop a tailored action plan. You could participate in an on-demand, self-paced online course that's offered by Better Kid Care. That's how we've taken our OSNAP learning collaborative model and made it an online course that more people can access. That is part of that research study that was part of my intro, where we were testing, can we do this online or do we have to do this in person? Because one thing I haven't mentioned so far is that OSNAP really began as this very local in-person learning community model where we brought multiple groups of staff from different programs in a particular city or region together to learn from one another. And we are still doing that. We're doing that on an ongoing basis, but we want to think of other training models. And so if you're interested in thinking about how you can build the capacity of staff locally in that kind of in-person model, definitely come and talk to us. But the online on-demand option is there as well. Next slide. So that's it for me. I want to thank you all so much for having me today. I hope this was helpful to get just a little bit of a taste of the types of resources that are available, and I'm available for questions now.
Thank you so much, Becca. What a great presentation, a lot of great information to soak in. So if folks do have questions, this is a prime opportunity to connect with one of our subject matter experts and really get some of those questions out there. So please feel free to either unmute or type in the chat. Again, thank you, Becca, for your really great presentation and information and resources. As folks are, turning those wheels for questions, one question that really stood out to me is when you talked a lot about policy and sustainability. That's a big one. Can you talk a little bit more about how those two relate and what has OSNAP learned from utilizing policy and understanding sustainability?
Absolutely. So first, what has OSNAP learned about policy? I think one important thing is we've learned that by having these pretty simple resources of the policy writing guide, and some of the there's a few other policy related, there's a policy assessment that we have. It's a pretty simple approach, and we saw really great improvements in our research study in people having the skills and confidence to be able to set their own policies. So that's the most important thing, is policy feels overwhelming, but it doesn't have to be. And I think these tools make it feel a little bit easier to create those policies. One of the things I didn't mention also is sometimes policy feels like something that if anybody here is an after school like site director type level person, like I can't do that, somebody else has to do that. But those informal policies also help us solidify things, and we're usually able to change the schedule, maybe the snack menu, depending on how we get our food, and a lot of the times the staff policies and the parent handbook, those can be ways that we can work with other folks in our large organization to change those types of policies. So we try really hard to think about what is feasible policy change in those materials. So that's the one thing we learned. And then connecting it to sustainability, I think what I observed over years of working with after school programs across the country is there's so many things on after school providers' plates, and there's so little time in an after school day. And so how can we put something on paper that says, this is the way we're doing this? You spend the time saying like, this is our practice. But if you codify it somehow in a policy, whatever level policy that is, formal or informal, it helps that practice keeps going the next school year. When there's a whole bunch of other things on different people's plates, it becomes the way of work a little bit more if it becomes a policy. So that's my perspective on policy change.
That's wonderful and so timely, because we know with concerns about funding and just the economy that the way it is, we always want to make sure we have a sustainability plan. Policy can definitely help with that. Does anyone else have any? Because I could ask better questions all day, but I'm sure that's not what you all want to hear. So I open the floor to anyone and everyone who may have questions. Again, it's a great opportunity to connect with one of our leaders in the OST field.
I'm glad to hear it's going to be a resource for Jimmy.
So in talking about, those informal policies, what are some examples, if you can think of any, of like some formal and informal policies that can be either adapted or changed that align with, physical activity, healthy eating? What do you think are some of those examples that, like you said, a director or a, site lead could possibly do?
So there were a couple, there's two things that I've already mentioned, which are schedules and menus, and I'll start there. And then there's a few others that we kind of bucketed as informal when we were thinking about things. But schedules, the idea of, taking those small breaks to be able to add up to getting to 30 minutes per day is like something that we often saw, and having people actually put in their schedule like 15 minutes here, 15 minutes here is like, okay, now like I'm doing the 30 minutes. I'm communicating now to parents, my staff, all the kids. This is how we're doing this. And so that's a way of doing informal policy change from my perspective, that really kind of is a lighter lift than some of the other stuff that you might have to like get sign off from somebody higher up or something like that. If a program purchases and provides their own snacks or meals for kids, and has the ability to change the menu. Sometimes you're working with a vendor and you don't have those abilities, but if you do provide those your snacks, communicating home on a menu that you've moved from having fruits and vegetables on one day to all 5 days is another way to set expectations through informal policy. Then some of the stuff that I would consider a little bit broader were things where people would put like, the way that we do things at this program is type of bulletin boards, or like, this is what we expected our program type of visuals in the space. To me is another kind of informal policy, because you're saying, every day we're active at our after school program. That's an informal policy. You're putting it like out there. It's an expectation. And then when mom or dad or somebody else comes to pick up the kid from after school program and they're like, my kid didn't get their homework done, they're like, well, look, we had to do physical activity today and they just didn't get it done. And so that's one of the things we definitely saw. And then I'll go back to the letters home to parents. Sometimes when people weren't able to make a formal policy change, they were able to say, write a quick memo home to parents that said, there's going to be some changes happening in our program. We want to let you know about them. And that's kind of another kind of communication / informal policy. It's like, now we're not allowing kids to bring sports drinks, and we hope that you will follow that new rule that we have. It's not in a handbook, it's not in a staff manual, but this is the way we're doing things. We're putting it in writing. So does that help? That makes sense?
That makes total sense. And it's a light lift.
Yeah.
And I think that's one of the things that's also really important to remember, is that we're not going to be able to do everything in one day.
No.
We're not going to be able to do everything in 1 year sometimes. But we want to do what we can. And that kind of brings us back to those SMART goals. Are those realistic? Are they timely? Are they measurable? So sometimes it's just the light lift that you need to do or can do to help create and advance equity within your OST programming. I'm going to continue to open it up, but I'll give it about a couple of more minutes. And if there just seems to be just an awe of silence because everyone's just so fascinated, I will totally respect that, and we will move forward. Claire Grace, did you have any questions for Beth?
I just was gonna kind of tag on to the end of what you said, that one of the things that we talked about in the assessment to action guide was this idea of like balancing some, we called it like low-hanging fruit. So like, it's great to have an ambitious goal that we're gonna bring in a new partner and we're gonna have local, produce in our program or whatever it might be. And that having something that is gonna take some time to like get some partners into place. And like Becca said, like maybe there's other people whose permission you need, like balancing that also with, some low hanging fruit or some quick wins of like, hey, we've looked through this list and actually we're already doing a whole bunch of these really well. And we want to make sure that our staff and our parents know that we're already doing these things that are, great things to do. And then here's a couple things that we actually feel like we could really easily implement just by letting parents and staff know. It could be more informal, or it could be something that we know won't take much time to integrate, and then kind of balancing that with, and then what's a bigger, more ambitious, something that we really want to take some time to work through all of these steps and come to a more formal policy on. So I think it's energizing when you have a blend of all of those things together.
Absolutely.
Well, Bianca, I can bring my slides back up if you want to kind of take us through the next few things here.
Absolutely. So again, thank you, Veronica, so much for your time, and thank you, OSNAP, for your time as well. So in talking about, creating an action plan and doing these assessments, we want to offer you, our fantastic members here today, an opportunity to connect with us in a variety of ways. First and foremost, we have office hours. So if you may feel that you have one particular challenge that you want to address, and you just need that, that personal time with us, please feel free to come to our office hours. But if you also have something, that not only is kind of very specific or individualized, but you want to take a little bit more time working on, you can also connect with us via our TA request form. So our office hours will be to continue conversations that we've had from our virtual institute, and potentially answering one or two specific questions. But if you have an individualized concern that you would like to address, please complete our TA request form. And we also have an upcoming community of practice coming up as well. Our community of practice is going to be a great opportunity to hear from various leaders within the field, as champions, as I like to call them, and an opportunity to hear from other peers about what they are doing and how they are doing it. So we can hear all about, promising practices, but it's always good and refreshing to hear from folks who are on the ground doing the work. And so that is what our community of practice will offer. Our sessions will be held January to May 2024. So we're going to be starting the year off right. And registration and descriptions are coming soon. So please be on the lookout for that information. And so as we continue in talking about our commitment to action, and just other ways of advancing health equity within OST, I wanted us to take some time to talk about how are we going to commit to action. Some great ways that we can do that. First and foremost, we want to download those HEPA standards. We want to also make sure that we are downloading our assessment to action guide. Again, both of those documents are available via chat. They are in the links have been provided via chat. We also encourage folks to complete the HEPA self-assessment and in-case equity planning checklist. So this is a really great opportunity for folks to take a moment to step back and really think about what are some of the amazing things that they're doing and what are some things that could possibly need some support.
Hey, Bianca, we have a minute. I'd love to have people actually think about what they want to commit to. We can use the annotation. And if people want to pull up the annotation menu on your screen, all you have to do is go to your little toolbar and click on the one that looks like a pencil that says annotate. It's going to bring up a little menu for you. And if you choose the check mark, that's a stamp, and then you can put an X or a star or a heart on any of these things that you are that you've done or that you're planning to do. And so I see a few coming in. So again, just that little pencil that says annotate and then the check mark, and you can grab one of those stamps and stamp something you've done already or something that you're planning to do after our webinar today.
Great. Thanks, Claire Grace. I was getting there.
Oh, yeah, no problem.
So again, there are some amazing things that you can continue to do. As we mentioned, we have our office hours, we have that request for TA, and we want to encourage folks to utilize OSNAP. So as Claire Grace mentioned, these are all great ways to commit to action, and really we want you to take some time to think about what can you possibly do, whether it be today, by the end of the week, within the next month or so. So again, as requested by Claire Grace, please use the annotate function and select something that you could do easily today. That's a short-term goal. And so far, I see a lot of annotation around checking out some of those OSNAP website tools that they were talking about. We see a lot of folks going to download the assessment to action guide. So really great steps. Again, all of these links are available within our chat, and we will also be sending follow-up information as well. All right. And so I also just want to provide some really good information about some of the work that we're doing. So again, as mentioned earlier, we collaborate with the National After School Association, and we have some phenomenal resources on their website. Feel free to check us out on the NAA website and select the Collaborative for Advancing Health Equity in OST. There, you can find some phenomenal resources, including great information about how do you continue the work that you're doing, whether it's around healthy eating, physical activity, equity, and etc. And of course, the recordings will be there as well. And of course, we always value your feedback. And so momentarily, we will put a evaluation survey link within the chat. We always love to hear back from folks. We always love knowing what folks are thinking. And we are always looking for ways to improve our work. And so we ask if you have a couple of minutes, which is as we do, because we're pretty ahead of schedule. Please fill out the survey where, again, we can hear your voice. Because we appreciate your time and we also appreciate your voice. So please take a moment to complete the survey and that link provided. And as you are continuing your survey, we would just like to say thank you all so much for your time today. We know your time is valuable, so we greatly appreciate spending it with us. So again, my name is Bianca Reed. You've heard from Claire Grace Jones today. You heard from Kate Goddard today, and our OSNAP partners in its work. So we thank you again for your time. And it looks like we're about to 10 minutes early, so I will give you 10 minutes back to your day. So again, please fill out that survey, and thank you so much for your time. Greatly appreciate you. Thank you, Beth. Greatly appreciate it.